call, Peter Aldous.
Thank you very much, Sir Mark. It's a pleasure to serve with you in the chair, and I congratulate my honourable friend and neighbour, the honourable member for South Norfolk, for securing this debate and leading it. That said, I just a bit of faint praise there. It is, I'm afraid, easier for an MP to secure a debate on NHS dentistry in this place than it is for one of our constituents to actually see an NHS dentist. The East of England, as we know, is the most arid region in the country. That is certainly the case in terms of rainfall, and it's probably also the situation with regard to NHS dentistry. As we've heard, it's been the number one item in many of our inboxes over the last 2 years. There are, I'm afraid, no signs of that abating, though from what the Minister has said, I do get the sense that the first steps are being taken to providing an improved service. There is much work to do, and I await the government's plan for NHS dentistry, and I'm very much aware of the hard work that my honourable friend has been carrying out, and hopefully he will be able to provide a publication date when he responds to this. And what I will now do is I will just highlight the sort of things that I believe that he should include in that NHS dentistry plan, with a slight slant towards the East of England as well. Now, the first item is, of course, NHS dentistry does require and need fair funding. And the BDA, the British Dental Association, they have estimated that if we were to restore budgets to their 2010 level, then you would be needing £1.5 billion a year. Now, that's not going to be achieved overnight, I recognise that, but there does need to be a meaningful start. And just two things I would highlight on the funding side of things. There is as I understand it, the annual budget for NHS dentistry is of the order of £3 billion, and just over 10% of that is due to be clawed back because it's not being spent. Now, I don't know if the Minister has given an assurance elsewhere, but that must remain ring-fenced for NHS dentistry. And I think the fact that you've got money that is not being spent really shows that the whole system is broken. And we saw that last year at the beginning of January 2022 when the government announced £50 billion of funding for what was described as a dentistry treatment blitz, and only 30% of that was spent. So, there is a lot of work to do on the funding side. I will just also highlight some funding issues from an East of England perspective. And the BDA, the British Dental Association, they did carry out some work before the pandemic that showed that spending on NHS dentistry in England does lag way behind what it is in Scotland, Wales and Northern Ireland. If we then home in on what is happening in England, some recent research was carried out. It was commissioned by the University of East Anglia. It was carried out by some people called Health Economics Consulting. And it very much showed that the East of England is the poor relation in terms of NHS dentistry compared to the rest of England. In the Midlands, they showed, this was for 2018-2019, spending on NHS dentistry was £78 gross expenditure per head. In the North West, £75. In the North East and Yorkshire, £70. In London, £69. In the South East and the South West, £59. In the East of England, I'm afraid we are the tail-end Charlies at £39 per head. And, Sir Mark, on that £39, I would submit there are a great many steps that we do need to be taking to address that particular inequality. My second point, as we've heard, is I'll be moving on to contract reform. The 2006 contract is discredited and it does need to be replaced. From what I can gather from what the government say and from what the BDA say, we have moved beyond what I would describe as the talks about talks phase of negotiations, and they are in meaningful discussions. And this mustn't just be tinkering with the contract. It must be complete root and branch reform. And some of the ingredients I would suggest we need for that new contract is we must make a clear break with the UDA, the Units of Dental Activity system of funding. We must discard the straitjacket as to how many patients NHS dentists can see. If they don't see enough, they get fined. If they see too many, they have to pay for it. We must ensure that more complex and lengthy treatments are properly rewarded, and NHS dentists are not discouraged and penalised from performing them. We must prioritise prevention. And I think, particularly from the East of England's perspective, somehow we must find a way of motivating NHS dentists to come and work in rural and coastal areas. The third point I'll move on to is recruitment and retention. And I think another plan we are awaiting is the government's workforce plan for the NHS and the care sector, and dentistry and must feature extremely prominent in that. In the short term, we do need to be recruiting more dentists from overseas. We have a situation in the Lowestoft area, actually in Beccles, where there is an NHS dental contract to a group called the Dental Design Studio, and they have been trying for some months to actually recruit 3 dentists from overseas. I think they're moving forward, but the issue of the overseas registration examination is carried out by the General Dental Council. It is moving fairly slowly. I've liaised with the Minister on this in the past, and that there is a backlog of applicants which does need to be removed, addressed as quickly as possible. Moving on from that, we do need to be training our own dentistry practitioners. That is hygienists and support work staff, as well as dentists themselves. And with that in mind, the University of Suffolk have set up a community interest company which has the objective both of carrying out treatment and also training, and with the creation of hubs. And it is an initiative that is up and running, and it does need additional funding so that it can be rolled out further across the region. And I would ask the Minister to do all he can to provide that funding. Longer term, there is the issue of a dentistry school, and we do not have a dentistry school in the east of England. We do actually have both the University of Suffolk and the University of East Anglia, who have thrown their hats into the ring to have a dentistry school. I think what the government need to do is just assess strategically in which regions we need dentistry schools. And I believe that there is a very big vacuum in the east of England, and then probably the UEA and the University of Suffolk do need to get together to come forward and put together one case rather than competing with each other. My fourth point is prevention. And as we mentioned, the new NHS dentist contract must have an emphasis on prevention, and the NHS does need to work closely with local councils in promoting better public health. And a point I would just quickly highlight is fluoridation. Now, it's not a particular issue in the east of England, but in one of the many debates we've had on NHS dentistry in this very chamber, I can remember the honourable member for Mole Valley, who himself is a practicing dentist, and he was highlighting the situation in Birmingham, where he, as a dentist, can actually tell which part of the city someone comes from by looking at their teeth, because he can tell, and he knows whether the water is fluoridated in that particular area. So I think that is a compelling issue which does need to be taken forward. I will also just highlight children's dental health. And 2 years ago in Lowestoft, an organisation called Lowestoft Rising, they got together with some local councillors, and they bought toothbrushes and toothpaste for the under 7s. It was an extremely successful project, and very quickly they had parents coming back and saying, can we have more? Unfortunately, more wasn't available, but it was suggested to me that we should be looking perhaps at 0 rating toothbrushes and toothpastes for the under 7s. And that is something I think we knew longer term we do need to look at very, very closely. My final point, Sir Mark, is accountability and transparency. There does need to be improved accountability and transparency with NHS dentistry, and I think we have made a significant step forward with the transfer of procuring going from NHS England to the new integrated care boards in the Norfolk and Waveney area. This happened as from the 1st of April. It is important that dentistry is properly represented on those ICBs, and from the feedback we've had from the Norfolk and Waveney ICB, they're very much getting to work with the problem. They're producing a 1-year plan for short-term interventions, and next March they'll be looking to produce their long-term dental strategy. And a point from my perspective, which is a major improvement, if I have a complaint about NHS dentistry, I can now go to the local NHS commissioners who I go to on other issues and who do give me a very good and quick and proactive response. Now, in geographical terms, so I'm reaching my conclusion, Sir Mark, is that East Anglia is probably the largest dental desert in the UK. And what we do need to be doing, metaphorically at least, with immediate effect, is bringing in the irrigators and sinking the boreholes. As I said, some preparatory work has been done that will enable us to improve the situation, but we do need that government dentistry plan as soon as possible. And whilst this plan is going to cover the whole of the UK, it must also address those specific problems in the east of England. That's our historic poor funding, the challenge in recruiting and then retaining dentists in our region, and the lack of the training facilities. Now, I look forward to the Minister's response. As I said, he impressed me with the way he's got about this task. But when he produces that plan, I would suggest it needs to be ambitious, visionary, and innovative, and not just a sticking plaster. Thank you very much.
I now call Jerome May.